Good morning.
The Manitoba Wake Up Crew. Jordan and Davey on NCI FM. Legendary country and more.
Good morning. 7 minutes after 9. Time for your COVID-19 update. Joining us, of course, Garth Hilderman, but we also have Dr. Marcia Anderson on our NCI lines. Thank you once again for joining us.
Thank you for having me. It's good to be back.
All right, so let's start with an overview of what's going on in the province with COVID-19.
Sure thing. So yesterday there were 112 new cases identified. So there is just over 1,300 active cases in the province. In terms of people in hospital with COVID-19, Manitoba reports two different numbers. There's 136 in total. 59 of those are still in their infectious period. And in the ICU, 31 patients in total, 14 of them in the infectious period. What we've been seeing is the test positivity rate rise, and yesterday was at 5.9%. For the listeners from the north, of those cases, yesterday, 27 of them were within the north. Currently, 634 active cases there. 17 people in hospital and 6 in the ICU. Now, one of the things we've been watching closely is the rising numbers of variants of concern in Manitoba, and there actually is a separate dashboard online now for people who are interested in that. This, of course, is important because of the evidence that these variants of concern spread more easily, and in places like Ontario and BC, they're seeing more severe outcomes and at younger ages. And so in Manitoba, as of yesterday, 412 total cases of variants of concern, mostly the B117 variant, which is the variant that was first identified in the UK, and 138 active cases due to the variants. Now, one of the most important things we can do right now is try to get people vaccinated, to try to, flatten the curve, so to speak, or interrupt the transmission of COVID-19, particularly the variants of concern. And so as of yesterday, just so folks know, over 279,000 total doses of COVID-19 vaccinations have been delivered in Manitoba.
Nice.
So why don't I stop there with the update and we can get into some of the questions that are coming up.
Sure. Let's focus first on that bit about the variants driving the infections in younger people, or younger people, I guess, driving the infections in terms of the variants. Isn't that almost going to stand to reason, given that older populations are getting the vaccine? Like, where else would it be?
Yeah, I think that's certainly true. We have seen, and people are aware that most of our early vaccine rollout was targeted at personal care home residents, and then with the decreasing age eligibility in the general population, and other provinces have been similar. So that, I think, is certainly one factor why we're seeing more cases in younger people. But I would also say that when we look at the wild type, which is the original COVID-19 that we had circulating, and the variants of concern in cases from that, a couple of things that Ontario has said are that they're actually seeing hospitalizations worse than their projected worst-case scenario. So when we compare the caseload and the current third wave that's happening in Ontario to the previous wave, which was related to the wild type, and looking in the same unvaccinated populations, are seeing more severe outcomes and are seeing the hospitalizations happening at a younger age than previously. So it's a mix of both who's been vaccinated, but also some of the different characteristics of these variants.
And are we seeing any variants yet in the north?
I'm looking at the graph right now, and it looks like there's a very tiny line present. That's on the variant of concern dashboard. So maybe it's one, but it does look like there is one there.
Just a matter of time, I suppose. Jordan?
Mm-hmm. Yeah, when it comes to the variants, do the vaccines work against all the variants?
So I think, as we've said repeatedly throughout this pandemic, the evidence is evolving very quickly and all of the time. And so people should be reassured that what the evidence is currently showing is that the vaccines do work equally well, particularly against the B117 variant. Still evolving evidence around some of those other variants, such as the B135 variant. but they do appear to work, and the underlying science or theory suggests that they will work, particularly against severe outcomes. And so really important that people are getting vaccinated as soon as they're eligible.
Do we have some idea of the uptake of vaccinations? Because we are trending a bit younger now in some of the populations, particularly First Nations individuals, age 40 and up now. Is there a big uptake there?
It's hard to say for sure at this point in time in terms of how we calculate uptake and the data that we need. And, of course, the province has, I believe, recently cleared the backlog of information. We are seeing pretty good uptake in the communities. And some communities have reported they believe it's in the 60 to 65% range. So some room for improvement, but very good for those first mass clinics starting. So that's been encouraging.
We just had a caller there, and he had a question there. He was on my hold, but he gave up there. He had a question of why. He had the question of why are businesses opening up, and he says like something about other businesses are breaking laws. Like why are businesses opening up? I guess is what his question was.
Sure, and I think the general answer is what is the right balance between using the least restrictive means necessary and preventing, the really rapid growth and spread of the infection. And that's a tricky balance to find. And so what we saw last week was really minimal changes to the public health orders. And I would just say that the public health teams, Dr. Rusin, the other MOHs, government, they're all watching the cases very closely, both here in Manitoba and what's going on in other provinces, particularly our neighboring provinces. And so we have to find the balance of the health impacts of restrictions that aren't COVID, so the mental health impacts, the other access to healthcare impacts, the economic impacts. So when businesses close down and people don't have the same income that they would have if they were working, those all cause significant impacts as well. And so that's why we're always trying to find the right balance. In terms of businesses breaking the rules, we do have extensive teams of public health inspectors, other officers who can pop into businesses and check to see if the rules are being followed in terms of monitoring for that as well.
Do you see an end in sight? I mean, like with all the masks and all the vaccinations, I'm guessing what point, how quickly can we get to the group
gatherings?
No, oh my goodness, I have total brain fart.
Like herd immunity, is that what you're wondering about?
Yes, that's a herd immunity. When are we going to reach herd
ding,
immunity?
Ding, ding. You get a gold star, Dr. Anderson.
Thank you. You're well trained in guessing what people are thinking. So, our government has said that they think they're going to have everybody receive their first dose sometime between, mid-May and the end of June. And, of course, whether or not we reach herd immunity after that first dose really depends on everybody in Manitoba who doesn't have a contraindication getting the vaccine as soon as they are eligible. And, of course, when we reach that herd immunity, the biggest benefit of that is it starts to interrupt the transmission chain, so we're less likely to see big outbreaks. So between mid-May and June, at least as far as that first dose goes, and then, of course, we need to roll and get those second doses into arms as well.
So Canada's health minister said they're looking at vaccine mixing as a way to fully protect Canadians. What's your take on that?
I think, it's one of the things that the evidence is constantly evolving on. I would certainly trust my colleagues who have more experience with the immune reactions to different vaccines and which ones you can mix with and not. I think we're in a situation where we have some populations who may have to have different vaccines, right? So, for example, the AstraZeneca vaccine, I have people reaching out to me and asking, I got AstraZeneca, now I'm no longer eligible for it because they're under 55, for example. What do I get for my second dose? And it's looking like the answer is probably going to be an mRNA vaccine, but we're waiting for those specific answers to come from NACI, the National Advisory Committee on Immunizations, and the other experts.
There's also been some concern that once you get your 2 doses, that there might be a period where this might be a yearly thing. Is that something that might be an option?
Yeah, and I think, it's looking like it's going to be likely that people are going to need booster shots. We're not totally sure of what the interval is going to be like. And then again, that's a place where there's likely to be some options around mixing of vaccines. So if you had your first 2 doses with Pfizer, doesn't necessarily mean you'll need a Pfizer booster in the future. And when we think about the long term of this, of course, we want to have as many options and as many delivery and access points as possible to keep our population immunized.
So just quickly, we got to wrap up in about a minute or so here, Dr. Anderson, but for people who need just that little bit more information or are looking to book their vaccine appointment, how do they go about doing that?
So the best thing to do for people who can access Google is certainly to just Google Manitoba vaccine eligibility. That will take you to the eligibility page, and it also has the phone number that you can call to book vaccines or the online booking tool there. So just would Google Manitoba vaccine eligibility, and you'll get to that information.
Thank you so much for joining us today, Dr. Marcia Anderson. We look forward again to chatting next week. Again, if you guys have questions, we'll be fielding them. We put a post up on our Facebook page for you guys to post answers up there, questions as well. Thank you. We'll catch up again next week. Marcia Anderson, PhD, doctor, never deadly person.
Okay, thanks, everyone. Talk next week.
Bye now.
Bye.
Good morning.